When aspiration strikes the lungs, it's not about infection, it's about inflammation gone wild. With ARDS, the real villains are the neutrophils. They get triggered by damage associated molecular patterns, and then they release proteases and reactive oxygenation species, and they just tear up the whole alveolar-capillary barrier. And what's the result? Leaky capillaries, protein-rich edema, and flooded alveoli. And so, since the left heart is totally fine, it's not like a plumbing issue, it's a permeability issue. And so, you see bilateral infiltrates after vomiting in an unconscious patient, somebody's like opioid overdose, then think ARDS, think of the neutrophils. So, ARDS, primary driver of lung neutrophil mediated inflammation. So, buzzwords: history of aspiration, fever, tachypnea, hypoxemia, bilateral infiltrates, and low PaO2, right? Because you have also acidotic. So you have the hypoxemic respiratory failure with respiratory alkalosis. So you have that initial compensation, and we get that PaCO2 is down. Okay, so normal heart size, non-cardiogenic, pulmonary edema, neutrophil activation, ROS, proteases, DAMPs, and also your cytokines. So TNF alpha 1 and 6. This is going to be like your acute phase, and this is going to be like for temperature, protein-rich exudate and hyaline membrane formation, damage to the alveolar-capillary layer. Okay, so 33-year-old man, acute respiratory distress. These are his signs. Which of the following is the primary mechanism? It's going to be your neutrophil-induced damage to your alveolar epithelium. ARDS is driven by massive neutrophil activation in response to alveolar injury. They release ROS and proteases. That'll destroy the epithelium and both the capillary and the alveolar, causing leaky capillaries and fluid-filled alveoli, and that causes hypoxemia and bilateral infiltrates. All right, and then that's what causes all of his signs. So aspiration striking the lungs, not infections necessarily, it's inflammation. ARDS, neutrophils. If you guys like free medical school education and want to see the platforms we're developing here, then like and subscribe if you're into that kind of stuff. All right, peace out.